about us. Think about
you. What's going on? How's everybody doing? Annette, how's it going? Good to see you on Instagram. As you guys can see, Dad's getting ready by playing guitar. There he is. Can you guys see me okay? D-Lynn, I see you. Roel, back over here on YouTube. Debbie from Australia, thank you. I see you at the type 1. Finbin does all help. What's up? Great to see you guys. Thank y'all for hanging out. Huge fan. Tom, what's going on, my man? I did live today. I did. Light. I'll say lightly. Yeah, Oliver, you see that music therapy? I don't think he knows we're live. Let's see. Wilma, what's up on Instagram? We're taking questions here as well. Let's see. Oliver, what's going on? We're going to let a few more people come in tonight. Thank y'all for hanging out with us this evening. Let's see here. What else we got going? Okay, we're going to be talking about this, as you can see with my hat here. I don't think Jake's in the building yet, but the raw deal on milk and gut health. This is where Dr. Rogers goes to Brookhaven Farms and talks about raw dairy. It's dairy month, and they're actually running some discounts, I believe, at Brookhaven. But great episode. Love Jake, love Brookhaven Farms and everything that they stand for. I'm going to show a little video here shortly. And then this was actually a clip from this show. The GLP-1 off-label uses. We put this as a clip on our YouTube channel. So anyone who is asking around how we're doing the GLP-1s under the current state of the whole regulations and everything. Doc talks a little bit about how he's doing that in office, and super, super fun little clip from this show. So thank you guys for asking the question. Hey, that was pretty good.
What?
A little music you were playing.
Oh, just warming up.
Yeah, warming up, getting in the mood.
Just warming up.
All right, let's see. Let's see who else we got here. Let's see how we're looking. Let's get you. There we go. I like
play
that.
that little Brookhaven clip. Did you play that yet?
No, we're getting ready to play it right now. Katie, thank you. We got our Brookhaven hats on. Shout out to Jake and Brookhaven Farms. Jerry, I see you. That's right. We look like brothers at least.
We do?
Yeah, I think so. Jerry, I see you. Who else is with us this evening? Let me know you're here. If it's your first time, I see you guys on Instagram. Mel Hall, I see you. If y'all have questions, you can put it in the comments there. Real quick, I'm going to show this little clip. Let's see where we're at. Katie will know this one. Tabitha, what's up? Let's see, where is it? It's down here. I hope Mom is watching. This is from Brookhaven Farms. It's National Dairy Month. It's just a little behind the scenes. We recorded there last week. Check this out.
All right, here we go. Hey, it's Jake, Brookhaven Farms. We're here with one of our little heifer calves, and she's just hanging out with me and Dr. Rogers. I think it's going to be Dr. Rogers' new assistant. No, she's a good calf, and we're just here and want to show you guys that we're a real farm, real people, real animals, and we provide real food.
I love it.
That was a cute.
That was awesome.
That was a great little.
How was that experience?
Oh, it was fun.
Was that cool?
That was probably the funnest podcast I think I've done.
Y'all, you had like chocolate milk. You had
drank
yogurt.
raw milk, and had raw yogurt. It was just fantastic.
Shout out to Brookhaven Farms.
I want to give you this $5,000 bill if you can name the name of that calf I was just petting. Anybody comes up with it, you get this $5,000 bill.
I don't think I can come up with it, and I just watched the whole thing.
I don't think I can either.
All right, we're gonna get going here. I see you, Mark. What's up, my brother? Foxy Moxie, Shelly, Lisa, what's up? Lotto, I see you. Lisa, Let's see where we're at. Okay, cool. We are all up to date. We've got a few people in here, so we're going to go ahead and start answering questions. We're on the podcast.
Who'd want to be here on a summer night? I mean,
Well, we're fun to hang out with.
I guess, but wouldn't it be funner to be out riding your bike or playing pickleball?
Well, I don't want to speak on behalf of any of the 31 people here right now, but there's nowhere else I'd rather be than right
We
now.
appreciate it. We do appreciate it.
We do. Thank you guys for being here with us on this beautiful summer evening. I hope we're either at the dinner table with you guys or we're outside on your phones. I hope you guys are having a blast tonight. Thank y'all for being here. And we got our team in here, Tabitha, Katie, of course. Thank y'all for being with us tonight. And we're here on Instagram. So Instagram, we're taking questions as well. So we're looking over there. Okay. Ready to rock and roll?
Ready? Yeah.
Real quick, I want to get to a few things we missed. If I missed you last week and I don't get to it, let me know. I'm paying close attention to that because I hate that we missed some last week. This was one that came on Instagram. It was around supplements for gout flare-up. I believe it was on Instagram. What's your thoughts? It seems that they had a parent who has gout and they had a flare-up. Is there supplements you recommend or like for this?
Most people will use something like tart cherry juice. That's a famous one. It also helps osteoarthritis. It's a good anti-inflammatory. Celery juice. Some people think that helps. Avoiding foods that have purines in it. Like if you have a lot of gout flare-ups, check your uric acid. And we do have good medications that work as well. But for the natural stuff, I like turmeric. I like ginger. I like celery and cherry. And you can buy them in combination, I think. I don't prescribe or recommend a lot of them, but I do like tart cherry juice most of all. That's probably the number one you can do. But avoiding the foods that cause you to flare it up if you have a tendency to have gout. And then if it doesn't work and the uric acid level is still high, you can get on some prophylactic allopurinol, which is a prescription medicine. But yeah, those are the things I would do.
All right, great topic there. Thank you for asking that last week. I apologize for not getting to it. And let's see here, another one here. I'm gonna have to read this. I did not put this in my notes here, so I'm gonna read this for you. How many times a day can you safely take meloxicam 15 milligrams?
One.
Yeah. Okay.
That's really the top dose.
Okay.
I've seen people take 2, but it's just not, the risk benefit's not worth it. 1 a day. I do like meloxicam if you have to take a non-steroidal. To me, it's the best one.
Okay.
Probably safer than ibuprofen, or naproxen. So
1 a day.
But 1 a day, 15 milligram, I wouldn't take any more than that.
Okay.
If I still had pain or inflammation, I'd probably add a good dose of turmeric to it.
Okay.
So.
Great question there. Thank you for being patient with me, guys. And let's see. I know there was one. Let's see. I think Tom asked about H&B with the H&B in the creatine. There, you are still a fan of H&B in the creatine.
It's in our creatine.
Okay. Okay.
It didn't used to be, but I added it months ago, so it's in all the new batches of creatine.
Okay. Are you still a fan of the creatine without the H&B, or do you would prefer it with the H&B?
I put an 89-year-old lady on it today.
Creatine?
Yeah, I did.
Just for muscle building?
Muscle. She's losing too much muscle.
Interesting. How many grams per day?
5.
5?
Mm-hmm.
I'm thinking about going. I'm thinking about doing 10 to 15.
Some people go up on it.
You do it once a day?
I think it's safe. Once a day. Yeah.
All right, great topic there. I see you guys on Instagram. If you have a question for Doc, go ahead and put it in the comments. If you guys have a question for Doc, go ahead and put it in the comments. I see comments are coming through. I see Oliver's question. I see Wayne's question. I see my brother Steve is in the building. Steve, what's going on, my man? Carter's in here. Carter, what's going on? I can confirm I will be in the annex first thing in the morning because we are running a special tonight. We're going to run a special on all of our supplements online. So I'm hoping for a very busy morning. So I will be there, Carter. I'm going to confirm that here in front of all of our friends. And I'm going to put that up real quick so everybody can see what that coupon code is. We're doing 15% off tonight. It's going to be live 15. That is the coupon code. You can put that on anything that you buy on performancemedicine.net. You'll get 15% off the total. So I'll see if I can't figure out how to keep that running. But it's live 15 for all those interested. If you have, and if I forget to bring it up, ask me. I'll let you know in the comments. All right, ready for another question?
Sure.
All right. My husband recently got his PSA through Quest Labs. He had just been receiving his total PSA, but this time he also received a free PSA and percentage. He has had prostate cancer around a year and a half ago and had the Tulsa treatment with Dr. Bush. So he gets his PSA every 3 months. It has gradually been increasing. However, his 1 year MRI check was clear. It's now 1.8, but the percentage of free to total is 11, which I believe is low. I'm just not sure what this means or really how to interpret it, since he's not had the free PSA reading before now. For me, will you kind of just explain what's going on? That's they're talking about PSA percentage.
Yeah,
ratios.
I did a podcast on the PSA and how to interpret it last week, I think, or week before.
Yep.
So go to that podcast. But basically, I'll talk about your husband's condition in a minute. But PSA, prostate-specific antigen, is secreted by the prostate, and typically we think, if it goes real high, you're at risk for prostate cancer. But we know that also having an enlarged prostate can cause your gland to pump out a lot of PSA. Where the free PSA percentage comes from and goes is there's two types of PSAs in your bloodstream. One is free PSA. That means it's not bound to other proteins. And the other is bound to proteins. And really, the more free PSA you have, the better it is. The more that are bound, or you're more likely to have cancer. So, if I have an equivocal PSA test, and you have an enlarged prostate, say your PSA is in the 5 to 10 range, and I'm not sure, if it's something to worry about or not. Also, there's a lot of other parameters you have to look at, like velocity, how fast it moves up, how the density, which really involves an ultrasound measurement, which is transrectal. It's not a fun one to do. It's very common. MRI is what we're going to. But in any event, so it turns out that the free PSA percentage is a pretty good way of calculating your risk for having prostate cancer in your lifetime. And there are different measurements for depending on what your PSA is. Really, the lower the free PSA percentage, the more risk you have of having cancer. And his is on the low end, fairly low end. I think you said it was 11, which is kind of medium, really, medium range. But I'm not sure it's a really good test for him to even get, because we know he's already has prostate cancer. So, and he's getting the procedure. He's had the Tulsa procedure done, which is a great procedure. Dr. Bush, was one of the first ones in the country to do these MRIs of the prostate. And now he's been doing these procedures that are more focal, ablative. A lot of it, and Dr. Bush is fantastic. He's wonderful and knows a lot about prostate health, cancer, and large prostates. Some people get the Tulsa procedure just to debulk their prostate, even if they don't have prostate cancer. It's a transrectal ultrasound treatment that heats the prostate up, and it's focal because you're in a live MRI machine when you get that procedure done, so they can tell the area that's maybe suspicious, and you can get it all. So it's a lot more focal. You don't have to destroy or take out your whole prostate. So it has a very low incidence of any kind of incontinence or ED or anything like that. So it's a great procedure. He's certainly done a bunch of them. So, and people that are amenable to this treatment just depends on the location of the cancer, which they can identify through the MRI. And it's amazing how he can do this kind of technology, number one, to scan your prostate, but also to fix your prostate. So there's a very low incidence of having problems after your procedure. So outpatient procedure, go home. So it's almost the way to go if you're a good candidate for it. But I'm just not sure as far as the PSA percentage, how it's going to help. And really, you do need to follow the PSA. For somebody that's had their prostate taken out for prostate cancer, their PSA should be 0. And very close to 0 for years out, unless it recurs. Because they didn't take his prostate out, they just did a focal ablation. It heats it up through ultrasound. Then you're going to still be popping out PSA because you still got your prostate gland. You just need to follow it kind of closely, just to make sure. It usually settles down after the cancer's gone to more of a baseline. A lot of that depends, his prognosis. A lot of it depends on what his Gleason score was.
I think I'm not seeing a Gleason score. Shoot.
Well,
okay.
I'm just talking about this, but
okay.
That is a measurement when you have a biopsy of how aggressive that cancer is. It goes anywhere from a 6 to a 10, and there's different divisions within those parameters. But hopefully, he had a low-grade Gleason, and it got taken care of. But he does like to follow the PSAs. But the free PSA percentage may not be anything that he really has to do again, in my opinion. They may come down with a better test, like a 4K test. There's a lot of different things they're coming up with. But so I would say, hopefully Dr. Bush got it all, but he does need monitoring. And then he'll, like you said, he had a normal MRI that should be done yearly once he's kind of settled in. But PSA is just a good way to kind of follow it. If you listen to my podcast, it's not a fail-safe, that reliable test, and it can be affected by a lot of different things. So go to my podcast and look at when you should check your PSA and etc. But it's really interesting measurement, and it can unnecessarily scare a lot of men off when their PSA is over 4. But usually it just means they have an enlarged prostate. But certainly the MRI has been invaluable to us, rather than just go blindly do 16 truss big core needle biopsies. It's painful as all get and can cause infection. It's better to have an MRI directed with a fine needle biopsy, where you can see. It's not guessing at it like you were on what they used to do.
Yeah.
And what a lot of people still have to do because they don't have the technology. But certainly the MRI guided biopsy is the best. And certainly the Tulsa procedure is something that's gaining a lot of popularity because of the least invasive form of treating prostate cancer. I think there is, and involves no radiation, like the proton therapy can. So interesting. I hope he does well. I think you will.
I'm really thankful for that question that came in through email. I hope that helps a little bit. And, as you guys know, June is Men's Health Month. So, if you are with a man tonight, if there's any men in here in the live Q&A, if you have any questions around the PSA, prostate cancer, testosterone, please put in the comments. We're here to help as much as we can. See a few people over here on Instagram. I see you guys. I see Montana's in here. So good to see you, Montana. Thank you for being in here tonight. Such a good crew tonight. Goodness. Coal miner's daughter, I see you. Elena, hello. Great to see you guys. Lisa, thank you so much. And please, I don't know if I missed your question last week. I might have. I'll make sure to get your question tonight, Lisa. All right. If anybody has questions, put in the comments. That was the only one we got throughout the week. And if I missed you last week and didn't put it in my notes, I apologize. We'll get to that this week. Just tell me I missed it, and we'll it'll catch my eye. Real quick, we got a few people in here. I'm going to put this up again for 15% off all of our supplements on the performancemedicine.net online store. Live15 is the coupon code that'll get you 15% off. And because my brother Steve's in here, this will also be up on our store. There you go, right there. 5 prebiotics, 11 probiotics, 30 enzymes, Digest Shield, our favorite power your gut with Digest Shield. We came up with that this morning. How cool is that? That'll be 15% off as well on the website.
Best gut feel there is.
There you go. There you go. Shout out to Steve. We love you. All right, let's get moving. If you have a question for Doc, go ahead and put in the comments. We'll get to most of them. We're going to be here till 8. Let's get to Debbie. Good morning, team. Good night to you, Debbie. This morning over there in Australia. My question is, would there be any benefit for type 1 diabetic to take a GLP-1? That's a great question. I don't have a weight issue. I think I know what you're going to say.
Well, my daughter's a type 1, and she takes semaglutide, Ozempic, which is the same as Wegovy, and she doesn't have a weight issue. Really, it's allowed her to use half the dose of insulin that she used before. Certainly keeps her lean, and there's a lot of off-label. We know the benefits that are proven through studies of the GLP-1s, like reversal of non-alcoholic fatty liver, reversal of chronic renal disease in diabetics, less dementia, and probably less Alzheimer's. It seems to be a great anti-inflammatory as well. We see less addictions with it. Sometimes I'll put people on it that are addicted to alcohol or drugs. It's just like we were talking about last week when we had our little conversation with our friend down in Miami. Who's a neurosurgeon, and he's big on, he thinks about everybody should be taking one anyway, just because of the great benefits, half the amount of heart attacks and strokes. It's just amazing the positive benefits by these GLP-1s. Besides the fact that they do keep you leaner, you know, most everybody in America has metabolic syndrome or some kind of insulin resistance. So I like it for inflammation. So yeah, I mean, there may be some good reasons for you to be on one. A lot of the endocrinologists are now using it, even though it's not FDA approved for type 1 diabetics. You're gonna have to watch your sugars that you don't bottom out. But Kelly certainly hasn't had a problem. And remember, take the advice of your doctor, you know, not me. This is not intended to be medical advice, you know, per se for your own individual case. But certainly it's used in a lot of type 1s now.
Yeah.
It's certainly going to be off-label, but we use a lot of things off-label. Probably half of what any doctor does is really off-label. So, yeah, consider it. Certainly talk with your physician about it, and look at all your numbers and decide why you might want to use it if possible. Start out slow. People that have certain issues cannot use it, like people that have had pancreatitis or medullary cancer of the thyroid or MEN syndrome number 2, which I've never seen, but so certainly do all your research, but it's not out of the question, that's for sure, Debbie.
And I'm going to put this up just because you mentioned the GLP-1 off-label uses. This was a highlight from a few weeks ago. It's clipped up and it's on our YouTube channel. You can check that out. And just, I think it's 2 minutes long, but it gives a good kind of, you know, how we're using the GLP-1s for off-label uses and what those uses are. So Debbie, I hope that helps.
We call Ozempic injectable accountability.
I love that. I'm obsessed with that line.
I didn't make that up.
That's such a cool line, though.
That's a cool line.
Yeah, shout out to Dr.
Injectable
Osborne.
accountability. It's the only drug ever made that takes the human condition into mind.
I love it. I think that's so cool. Let's get to Mark's question. I'm going to try to figure out the Live 15 is the coupon code, just in case if anyone's wondering, if you're coming over from Facebook. Live 15 is the coupon code for the 15% off all vitamins. Mark is asking, wheat germ extract Avamar shows activity against prostate cancer cells, PC3 DU145 in unpublished or semi-published lab studies. Thoughts on using it as a preventative measure? Interesting.
I've never heard of it. So I don't know. Have to look into that.
Mark, what we're going to do, I'm going to take note of this, of these studies, and we'll get back to you. Mark's ahead of the curve. I love it. Thank you, Mark.
I have to go up to MIT just to talk with Mark. Mark, remember, this is a common sense MD, okay?
Mark, I hope you're laughing right now.
Don't throw a lot of fancy words around here because nobody, including me, understand them.
Hey, you know what? I will say, my pronunciation.
You're above our level.
My pronunciation's gotten better. I got a comment tonight from my wife, from mom. Like, I'm getting, my pronunciation is good of, you know.
You haven't missed one in a long time.
My pronunciation is good of all the whole sentence doesn't
Your
make
English
sense.
may not be good, but your pronunciation.
My grammar might be a little
You're getting
off.
used to all these medical terms.
Mark keeps me on my toes. All right, this is from Lato. I'm using L-leucine to stimulate GLP-1, which then activates the pancreas beta cells to release insulin. And it signals the muscle that protein is being digested. Okay, this is a comment. That's super cool.
Yeah, that's a great little comment there.
Yeah, thank you, Lato, for that.
That is that's one reason why you may lose a little bit of muscle in the GLP-1, so you got to be careful and make sure that you have enough protein in your system and you work out with weights. Otherwise, you could lose muscle with GLP-1s. But you always weigh the benefits versus the risk, and it's like 15% muscle loss, 70% fat loss. So.
You know, it's we did an episode of Dive Into Dive with our nutrition coach, Lucas Schmidt, and he says, like, he thinks he's a huge believer in the GLP-1s, and he thinks, like, on the label it needs to be like as like a warning, must lift weights or must do some sort of resistance training. You know, do an in-body scan. You know, make sure you're not losing.
That's the reason I bought those in-body scans, because I wanted to see if people were losing muscle with the GLP-1s that we prescribe so much. And so far, I've just seen good results from it.
Yeah, if you're intentional about your protein intake and you lift weights, like I'm sure,
and you take hormones if you need them, like testosterone.
Thank you for that comment, Lato. Let's get to D-Land. For about 2 weeks, our energy level is close to zero after about noon. Could be the heat. My clients keep their homes hot. What can I take for energy? This makes a ton of sense. It's getting hot. It was hot this afternoon. What's your thoughts just for energy? You know, one like methylene blue might be a good one.
Yeah, of course, CoQ10, PQQ, taurine, which I'll put in the energy vitamin that we made. You know, the other thing I would do, besides, hopefully you've had all your blood work done, you've checked your thyroid, your iron levels, and all the things we screen for metabolically. You might ought to consider wearing a Stello continuous glucose monitor, because it could be around lunch or after lunch you get a little hypoglycemic. So I would probably, it's really inexpensive and it's over the counter, the Stello. We've done a podcast on it, to look and see what's happening with your sugar levels when your energy level's so low. You know, I don't know about your sleep patterns, etc., but it's pretty common for most people to get a little drowsy after lunch. Sometimes it's a reactive hypoglycemia, but try to monitor that and make sure that you get all your lab work done, like a Cleveland heart panel that tells us about everything we need to know about you.
D-Lynn, thank you for that question there. Let's see. Keep moving. Thank you, D-Lynn, for that. You'll put this up. This is the coupon code. And put that at the bottom. If that bothers anybody, let me know. I'll take it off. Live 15 is a 15% off coupon code for tonight. Let's keep moving. Let's see where we are. I think we're let's go to Oliver here. Anything that helps with polyneuropathy?
Yeah, there's a lot of treatments for polyneuropathy. First, you know, if you can find a root cause for polyneuropathy. These multiple nerves are involved. Sometimes it's diabetes. Sometimes it's spinal injury. Sometimes it's just metabolic. Sometimes it's idiopathic, meaning we don't know. But I like vitamin B6 a lot. I wouldn't use over 100 milligrams because it may make it worse. Somewhere between 50 and 100 milligrams of B6 sometimes is helpful for neuropathy. So is turmeric, curcumin. That's one of my favorites for nerve pain. I like CBD. CBD is a great treatment for polyneuropathy. I like the muscle and joint one, that gummy that I use sometimes when I tweak something playing volleyball, or not volleyball, pickleball.
Volleyball.
I just saw volleyball tonight as I was riding my bike back here. I keep thinking about volleyball.
Volleyball is actually such an athletic sport.
Yeah, I don't think I could do well at volleyball. Pickleball, I can do well at.
He's a volleyball player now.
Matter of fact, we need to play that video hitting that shot. Did you see that shot I hit the other night?
I did.
Somebody was filming us playing pickleball, and I hit a lot of trick shots when I played pickleball, between the legs, behind the back, stuff like that.
They call him Trick Shot Tommy.
Yeah, that's what they call me. Because I'm not real serious. I like to have fun when I'm out there. I really like to have fun. Some people, it makes them mad because they think it's kind of being a hot dog. I just love to do it. But somebody took a film, and they may have to play that sometime. But
we'll find it. We'll put it at the beginning.
Yeah, me hitting the winner off one of my trick shots. Anyway.
Oliver, thank you for that. We're going to go to Wayne's question. Wayne, good to see you, brother. Do you prefer nasal spray Silank/Simax? Am I pronouncing that right? And how much would you dose?
Man, I'm going to have to look that up. I don't know enough about that to really give you an educated answer on that. I don't know a whole lot about that spray, so I'm going to have to really do a little research on that. We'll do that next week. Just remind me.
I'm putting that on my list here, Wayne. Nasal spray Silank Simax.
Somebody may have a good answer. I don't know. Mark is like the encyclopedia.
Anybody have some thoughts for Wayne in the comments? If it's on Facebook, I'll put it up so he can. So for clarity for sub Q. Okay. Thank you, Wayne. They'll put that down, and we'll look in the comments as well if anybody else can help. But we'll hopefully have more information next week. We're going to keep going. Let's see where we're at. Shelly's got a question around nicotine patch. We talked a little bit about this last week. Thoughts on nicotine patch for Epstein-Barr virus reactivation?
I put somebody on nicotine patch today it's interesting. About 2 days after she took her first and only COVID shot, she couldn't smell or taste. And that's been a few years ago. She's been to a couple ENT doctors, no help. So I did put her on the nicotine patch today to see if it would help. There's a lot of reports that it can help. There's a lot of good things that nicotine can do besides being in a cigarette. That's a bad thing. But yeah, we saw a lot of EBV reactivation with COVID. We saw it a lot with the vaccines, and I like it. I think it's worth trying out. And the other thing, if you did take the vaccine, you might want to do Dr. McCullough's detox from that spike protein detox protocol that we talk about a lot. And so if you need a copy of that, just look up Dr. McCullough's spike protein detox protocol. But yeah, try the nicotine patch. It's not going to hurt you.
Thank you, Shelly, for that. Steven's in here. Steven, good to see you. Danny, good to see you, brother. Let's get to, I want to make sure I get to Lisa tonight. I had colon surgery the last week of January 2025. I've passed some blood this week, and today I have very swollen like a blimp and feel trapped, gas that won't move. Is there anything I can take to get this to feeling better? I was like this a couple weeks following my surgery, but not again till now. I feel like something is not right. What's your thoughts on this?
Yeah, you may have just trapped gas. You may have a slowed colon, small intestine. that happens a lot of times right after surgery. It takes a while for your peristalsis to get activated again. And I don't know what may have set this off. It's very common. As a matter of fact, it's the rule after colon surgery that's going to take a while to get your bowels getting that kind of movement again. So it might have been something you ate. You need to be on something like Digest Shield every day anyway. You might add to that something like simethicone, which is Gas X, and try that. If you start to have a lot of pain that's unrelenting, you need to go in and get it looked at. They can do a CT of your abdomen. I ordered one today on a guy, and make sure that you don't have an ileus, is what they call it. And that means it's not moving. And sometimes it can kind of crimp off. When you have colon surgery, any kind of intestinal surgery, you can get adhesions that can actually kink up your colon, small bowel.
Yep.
And they have to go in there and unkink it for you. So don't take that lightly.
Yeah.
Try those things that I've just mentioned and try to get rid of some of the gas. Hopefully that's all it is. And don't eat anything. Clear liquids only for the next 24 hours.
Lisa, I hope that helps a little bit, and keep us posted next week with how that's going. That's a big deal.
We're thinking about you.
Yeah, we're thinking about you, Lisa. Thank you so much for being here. Real quick, I want to put this up from Karen because it has to do with the previous question around the nicotine patch. What dose, location on body, and how often to switch out?
I think I would do the 2.5. I'd go slow. Get the lowest dose you can. Because some people will flush a little bit. Some people, you ever chewed tobacco?
Never chewed tobacco, no.
Dipped a skull.
Man, once, and it was not a good experience.
I did it one time in hospital. I was so sick. I hated it. But the patch is really long acting. That's why I like the patch. You can put it on your outer thighs, where I tell most people to put it.
For some reason, I always thought arm.
You can put it on your arm. You can put it on your flank area. Just start out slow. Some 24 hours. Sometimes I tell people to use it a couple times a week, just to kind of get used to it, and then certainly.
So a couple hours, a couple times a week.
No, leave it on. It's a 12 to 24 hour patch.
Oh, okay.
Leave it on unless you get dizzy or have some side effect from it, and then take it off. Because nicotine can kind of make you feel weird if you got overdosed on it. It's not going to kill you, but that's why people that used to pick tobacco and cut it and all this, until they got used to doing that, they used gloves because it would absorb through their skin. And they, especially if they used to have little kids do it, on the farm. Yeah. And they would sometimes really get sick at their stomach, and they kind of go crazy in their head a little bit. So those are the warnings about it. But get the lowest dose you can. It's over the counter.
Karen, thank you for letting us clarify on that. And real quick, Terry's in the building, and I've got a little thing. I got a gripe with you because apparently Terry brought some beautiful South Carolina peaches, and you didn't bring any home.
I've got a gripe with myself. I was there Friday, and I saw those beautiful peaches, and I left without remembering to put them in a little takeaway basket. So I hope there's some left.
Terry,
that was Friday. Terry, thank you.
Well, what are we gonna do with this guy?
If Carter's still there, and she's coming to Kingsport. Carter, could you bring us a few peaches?
We need to get those peaches. Terry,
those South Carolina peaches are the best.
Terry's in South Carolina and brought some peaches to the office. Terry, we love you, man. Thank you so much for that, as always. All right, man. Thank you, Roel. Thank you so much. 15% off tonight. Roel just took advantage of it. Live 15 is the code. Thank you, Roel, for putting that in there. I see Jake's in the building. Jake, what's going on, man? Look at this. Hey, Brookhaven Farms. We love you. Jake was the star of that video. I'm gonna put this up for Jake.
Play a little video
real quick
at the very start of the show, Jake.
There he is. Jake's right there. Jake, what's going on, my brother?
We drank some raw milk, and we ate some raw yogurt with maple syrup, and it was just fantastic. That was the funnest podcast I've ever done.
That's awesome. Jake, look at that, man. Thank you so much for having us out. And guys, if you haven't checked out the video, check out the video with Dr. Rogers and Jake Hubbard over at Brookhaven Farms. Thank you, guys. Katie's saying the orders are coming in. Thank you so much. We appreciate you. Live 15 is the code. All right, let's keep moving. We're going to get to as many questions as we can. I see Megan Inspiration, but I'll get your question in just a second. I saw, there we go, Elena. What causes diverticulitis or diverticulus, and what protocol to follow?
Diverticulitis and diverticulosis. There's a big difference.
Maybe this is losis, or is this?
I don't know.
Or is this litis?
I don't know.
Elena, make sure I'm getting it right here.
Diverticuli are little pouches that pouch out from the colon. Look like little bubbles, and usually, a lot of times they're inherited. As much as 50% of adults may have a few of these, but people that have a tendency towards constipation will form more of them. They're like little pouches, and sometimes if your bowels aren't moving right, you don't have enough fiber, things can get stuck. Particulate matter can get stuck in those little pouches. They get inflamed, they get infected, and they can cause a lot of pain. Saw a patient today with what I think is diverticulitis. You have to use double antibiotics. I sent him over for a CT of abdomen to make sure, because they can differentiate between just having diverticuli and if they are inflamed. And if they're inflamed, they need treatment, because you can really get sick with it. A lot of times you'll have bleeding from them, rectal bleeding. That's one of the most common causes of what we call a tick bleed. But certainly the key to, if you have those, the key to that's eating enough fiber and making your bowels move normally. They used to say don't eat seeds and things like that can get stuck in them. Then they came out diverticulus.
It's probably
it's litis, probably litis.
Probably litis.
I think that's what you're getting at. But some people call it left-sided appendicitis, because it's usually on that left side of your abdomen that you hurt. That's just the most common site that we see this. But certainly, we usually have to use some pretty heavy hitters to get it, like metronidazole. Sometimes I use a cephalosporin. I don't like to use Cipro. Sometimes I'm forced to. But it can land you in the hospital if it goes on for long. So a lot of people, if it becomes recurrent, need some antibodies to kind of have on hand in case they do get a case of it. But it's tender, usually left-sided abdominal pain. And you have a history of it, and you're going to have to get it worked up to see if that's what you have, so you'll be prepared for the next time and you'll know. I certainly think that even though they came out a few years ago and said, well, eating seeds or nuts makes no difference, in talking to patients for 40 years, I think it does make a difference. I think you ought to avoid them, because I've seen it precipitate diverticulitis. So be careful. It's a common condition, but it can be really, you can land in the hospital with it.
Elena, does that help any? Let me know in the comments. I hope that helps just a little bit. And I'm going to real quick get over here to Megan Inspirations. Megan, thank you for being here on Instagram. I see Steven's in here as well. Thank you, Steven. Megan is asking any advice on diet, supplements, and or next steps for a low EGFR and elevated creatinine level. And Megan's right over there.
Yeah. Diet for it. Some people would tell you to avoid a carnivore diet, because sometimes when you have a low GFR, which is a kidney filtration measure, that too much protein can put extra pressure on your kidneys, especially if you're losing protein through your urine. You need to have that checked. We need to check your urinalysis. But the main thing you need to do there is to avoid having high blood pressure. If you have high blood pressure, which is the most common cause of a low GFR, that they call it, that's probably a grade 3 renal failure. It's nothing to freak out over, but avoid non-steroidal anti-inflammatories because they're really hard on your kidneys. Certain other medications can also be hard on your kidneys, but that's the main group that you need to avoid, like ibuprofen, naproxen, those type of drugs. You need to keep a close eye on that too. And if it's lowering, if it's getting lower, you probably ought to see a nephrologist to have some other tests run to make sure you don't have any IgA nephropathy, any of the weird things that could crop up that your regular primary care doctor is probably not going to know too much about. So if it is lowering, have one visit with a nephrologist, a kidney doctor, that can look and try to look for causes, and there's other treatments for it if it gets worse. Certainly you don't want to wait till you need to go on dialysis to discover that you had a low GFR. Now, the other thing that I see that's important to remember here is some people will have a high creatinine with a normal GFR. And usually I see that in people that have a lot of muscle. And if that's the case, and your blood pressure is normal and you have no reason to have a creatinine of, say, 1.5, then you need another blood test along with your creatinine measurements and GFR called a cystatin C. And a lot of times, if it's a muscular man, I'll see that his creatine, I'm taking creatine, I'm worried about it. Really, creatine does not affect your creatinine measurements, shouldn't. But so look at that with a cystatin C if you're worried about it and you're on the borderline there. I do that quite often.
Yeah, I think one that's come up, I see Tom's comment there, like that the when you do have a lot of muscle and that creatinine spikes a little bit, you do need to get that. What's that?
Cystatin C.
Cystatin C. And Motab, I think, brought it up one time.
Yeah, and usually it'll show that your GFR is normal. Your creatinine is really corrected. Creatinine is normal. So,
Megan, does that help? Let me know in the comments there. I hope that helps a little bit. Great question. Let's get to a lot of comments coming in. Thank you guys so much for all these kind comments. I thought I saw Rich in there. There we go. Rich is asking, what are thoughts on the therapeutic use of food grade hydrogen peroxide?
Yeah. A lot of your athletes are using it. Hydrogen peroxide, which I think I did a podcast on one time, didn't I?
Which one?
On hydrogen peroxide. I think I've done one.
Really?
I believe I've done one. Remember, when we give high dose IV vitamin C, how it works for cancer is because it turns into hydrogen peroxide, which is destructive for cancer cells. So, you may, again, that's going to be a lot more therapeutic than just food grade hydrogen peroxide. But it does have an anti-cancer effect. Some people think it may give them energy. It's just an interesting kind of debated, opinionated hack that you can do. If I haven't done one on, I should do one on.
I'll look at that. It might have been underneath like a high dose vitamin C episode, because we have talked about high dose IV vitamin C.
Yeah, the way you may have heard about it and seen it used is through nebulized hydrogen peroxide during the COVID epidemic. Dr. McCullough and some of those really used a lot of it. I had a few patients that did it. It does seem to help kill viruses. So it's pretty therapeutic in that sense if you use it in a nebulizer. But you have to know how to mix it and everything. And Mercola gives pretty good directions on that in some of his websites.
Rich, does that help? It's a great topic. I haven't heard that come up in a while. So thank you for for letting us.
It's
talk
good for
about it.
other things other than cleaning a wound.
Yeah, great stuff. Great question there, Rich. Thank you so much. Let's go to Steven. I see Steven's in here. Let's see if I can read it. If on tirzepatide and experiencing a lot of constipation, history of diverticulosis, any suggestion on something that stimulates motility? So this is someone who's on tirzepatide and has a history of diverticulosis. So it has to do a little bit with what Elena was
Well,
talking
of course, you need to take a good pre and probiotic combination. Like again, my favorite is Digest Shield for all that stuff. If it was just purely constipation, then Dr. Schultz's intestinal formula #1, which we ordered by the caseloads from California, is my best agent to kind of help that naturally. It's all natural ingredients. Especially if you've taken some mag citrate and it's not working. But certainly that is a side effect, and some people can't take it because of that. But it's very few. Usually people can kind of get things moving. A lot of water and a lot of exercise. Never forget that either, besides the fiber.
Stephen, does that help? Let me know in the comments. I hope that's a very common question. So thank you for putting that in there around tirzepatide.
And remember, you're not eating as much either. So you don't have the bulk either.
Yeah. Which is why you need to make sure you're getting your macros in first. Yeah. Make sure you get your protein in. All right, let's keep moving. Elena's got a great question here. Where's the best place to get a We Are Stello? So a Stello.
Yeah, you can come in our office and they can put them on you. You can order them off Amazon, but really, my nurses put a lot of them on and set it up with your smartphone. So that's a good place. I'm not sure if the pharmacies are even setting them up for people. I think you either have to order them off of Amazon. We kind of got tired of people, buying them off Amazon or didn't know what to do with them. And so we ordered a few of them in bulk at the same price and very close to it if it's not the same, and bring it in, and one of the nurses will set it up for you and show you how to use it.
And Stello is the brand. Is that right?
Yeah.
Okay. Elena, I hope that helps. Stephen, yes. Dr. Schultz formula.
Schultz, yeah.
Schultz, and is it SCHULTZ?
Yeah.
Yeah. Dr. Schultz formula. All right, let's see where I'm at. Let's go to Michael. Thank you, Michael, for being patient with me. Can BPC 157 help with thorax outlet syndrome?
Thoracic. Yeah, BPC 157, thoracic outlet syndrome. Man, that's a toughie. BPC 157, body protection complex, has a lot of uses. I take it orally every day. It's good for your gut as well. But injectable, certainly to heal injuries. And in that case, then you inject it subcutaneously around the injury. I'm just not sure if it's going to help thoracic outlet syndrome. I've never seen it used for that. If you inject it around the rib area, a lot of times thoracic outlet's caused by an extra cervical rib, and they have to go in and take the rib out to make room for that nerve bundle that comes through that tight area. So you can certainly try it. I take it orally. It's not going to help. It's not going to hurt you, but I'm just not sure how much it's going to help a good case of thoracic outlet syndrome, which we don't see too much of.
Yeah,
causes a lot of arm pain, and it's usually more of a surgical decompression solution.
Michael, I hope that helps a little bit. Is BPC 157 you can also take orally though, right?
Yeah, I take it orally, yeah.
Okay.
Or you can inject it subcutaneously around the areas of injury.
Okay. Thank you for that question. Let's see where I'm at. Okay. I'm going to get to Jerry, then I see Angela's in here. Thank you, Angela. Can you take nattokinase bromelain and serrapeptase together also when having radiotherapy?
you know, they all kind of, except for bromelain, they all kind of have a little bit of a blood thinning effect. You need to. I'm scared to tell you yes, because you need to take the advice of your radiation therapist before you do that, because I'm not sure if you should or not. I can't think of a good reason not to, but certainly, and I have a lot of people that take both nattokinase and serrapeptase together. They both kind of naturally thin your blood, but they have other separate benefits. But make sure you talk to your radiotherapist before you do that. They may have some reason why they don't want you to do that.
Thank you, Jerry. I hope that helps a little bit.
The one, artemisinin, is the one that I know is contraindicated with radiotherapy. So artemisinin is an herbal-like substance that we use a lot as an adjunctive treatment for cancer, but you don't use that one with radiotherapy.
Thank you for the question, Jerry. Thank you for being here, as always, over there on YouTube. Thank you. Let's get to this. And Angela's asking, Angela, so good to see you.
Hey, Angela.
I got to see you in Knoxville a month
We
or so
miss
back.
Angela.
I do. We miss you so much. I got to see Angela a few weeks back.
You did?
Well, maybe a
She
couple
loves
of
Knoxville, doesn't she?
She loves Knoxville. Angela's question is, by chance, did you do a podcast on detox from COVID vaccine? I don't think you've done.
No, I don't think we specifically have, but if you look up Dr. McCullough, he's the expert. He's a cardiologist who's an amazing, well-published physician scientist, and he's even testified on Capitol Hill. Read some of his stuff. All you got to do is get on his blog and look at his protocol on the detox from the spike protein. It's really good stuff. And I think all our offices have a copy of that too. Yeah. If you need to call the office and have them send it to you, Angela. But listen to Dr. Peter McCullough's stuff.
Yeah,
it's really fascinating. You know anybody that's happy they took that vaccine? You know, one person that's actually glad they took it. I can name you one person.
Let's keep moving.
Is anybody out there? Let's have a vote. Anybody have it? We'll get it. Let's use this. Let's use this $5,000 bill for anybody that's known one person that was glad they took that vaccine.
Let's get to
it's probably not worth anything.
Ruel's question. I got Roel and Ruel. Ruel, thank you for being here as always. Question: I'm taking max dose of losartan and max dose of amlodipine as a booster for my blood pressure. It's doing the job, and I'm getting the swollen ankles. Any recommendations for a different med/combo? I previously took
that's a great question.
Lisinopril, but had some brain fog with that one.
I personally don't like lisinopril. It's just you have the ARBs, the alpha-7 ACE inhibitors, and they're just so much safer, less side effects. I've seen lisinopril cause immediate angioedema. In about 30% of the cases, it causes a chronic cough. So I never use it anymore. It's usually, but if you look at the list of drugs to start somebody on, that's number one. It's so cheap, but we have also generic ARBs like losartan. Losartan is a great ARB because it's the first one that went generic, but I like irbesartan better. I think it's more potent. And I do like that class of drugs. Now, amlodipine, which is a potent calcium channel blocker, is great. It works, but I try not to use it over 5 milligrams, because when you get to 10 milligram, which is the max dose, it causes constipation and edema in your lower extremities. Some people just add a diuretic, but I do not like diuretics unless I have to use them, unless you have a lot of fluid retention. Because a lot of diuretics, especially HCTZ, which is one of the first ones that we used to step therapy on, it causes inflammation of the blood vessels. So I don't use it. Also lowers your T testosterone level. So you might switch to the max dose of irbesartan, lower your amlodipine, and there's other things you can do as well, other blood pressure medicines. I like, if you want to do something natural, I like berberine. I like hawthorn. I like exercise. I don't usually recommend salt restriction. Salt is not bad for most people. Salt does not affect most people's blood pressures in a negative way. Matter of fact, salt's good for you. There are a few people that are sensitive to salt with their blood pressure, but it's a very few. And in that case, it's probably about 1 millimeter mercury difference. Read a Midwestern doctor's take on salt. It's a really good soliloquy on how salt has been demonized along with fat. Two things that they got completely wrong.
I'm going to put this up from Wayne because it's a comment around this question.
Yeah.
Caused cough big time now on Itorbiclar, and I'm Lodipine. Thank you for putting that in there, Wayne.
Yeah, good point. Try not to go over 5 milligrams of amlodipine unless you have to.
Real quick, I want to put this up from Rich just because you've been talking about doing a podcast on DMSO for so long. This is
I know.
This is an amazing testimony. He suffered from plantar fasciitis for 10 months after 3 days of rubbing DSMO on feet and heel. I am pain-free going. That's amazing.
DMSO
cool.
is.
You were talking about like yesterday.
I talk about it all the time.
I know.
I just have to and I've sourced it. I really want to develop a cream or a tincture that has it in it. It's been around forever. If you ever want to learn about DMSO, go to the blog from a Midwestern doctor. Guy smart.
Yeah.
And he loves DMSO.
Let's come up
for
a few
many
times.
reasons. So I'm not going to come out with a podcast until I'm absolutely an expert on it. And I've experienced it myself. Again, I don't try anything on a patient that I haven't tried on myself.
Thank you, Rich, for that. I'm going to put this up from Angela. From a derm perspective, I tell patients to switch if they're having problems with stasis dermatitis. I believe that was around the question with the losartan. Yeah. Thank you, Angela, for that.
Yeah, that is good.
Yeah.
Stasis dermatitis is usually due to poor circulation, and because of the tightness and swelling, you get this brownish discoloration to your lower extremities, and it never goes away. This pigmentation, and it's usually because of circulation. But that's a great. See that in derm all the time, I'm sure, Angela.
Thank you, Angela, for that comment. Real quick, I know we're running out of time. I'm going to see. I know. There we go. Megan is asking, is it possible to have bilirubin and protein in a urinalysis if dehydrated? Am I pronouncing that right?
Bilirubin.
Bilirubin and protein. And protein in a urinalysis if dehydrated.
It'd probably be more likely, but if you have that in your urine, you need to get a chem profile to look and see what your blood bilirubin and liver function tests look like, and also repeat that urinalysis for protein, and probably end up looking at your renal function, do a 24-hour protein level. But that's something that you may have some kind of nephropathy, kidney disease that needs to be looked into. As well as a compromised, when you have an elevated bilirubin, you could have gallbladder problems, you could have a liver duct problem, that kind of thing. So don't ignore that. Work it up.
Thank you, Megan. I hope that helps a little bit. Real quick, let's get to Mark. This is a good one here. Brad Blackwell intro is amazing. It is. Shout out to Brad Blackwell. When will we get a Dr. Rogers solo guitar intro?
Very soon.
We need to record that.
Very soon.
We almost have one today.
I'm not nearly as good as Brad.
No, he's not. But Brad's amazing. Brad's like a professional.
Yeah, I'm a very amateur guitar player. People that can't play guitar that well collect guitars. So I guess I would say I'm a guitar collector, an amateur player. But however, I will probably present Blackbird someday, which is a very difficult guitar solo.
The intro.
I worked on it for 1 year.
I want to put this up from. Thank you, Mark, for that. I'm going to put this up from Christy. Thank you for this comment. I have post-vaccination syndrome thanks to the COVID. Andy suggests I try the protocol on imahealth.org as a lifesaver. Thank you for putting this in there, Christy.
Thank you, Christy.
I hope that. Thank you for the positive comment there. Real quick, do you want to just give like a little intro to DSMO, and then we'll call it a show?
DMSO has been around for decades and decades. It was used back in the 60s for inflammation and pain. I think it's dimethyl sulfoxide is the chemical name of it. You can go on Amazon and get some creams right now over the counter. Now, for the higher doses, you're going to have to get a compounding pharmacy to mix it up, and that's why I really am hesitant about coming out with a podcast until I know where to source it and can help people with it. I don't want to do something that's not going to be available to it. Unfortunately, the FDA does not like it, mainly because it works and it's cheap. It's been around forever, and it's repurposed for many things. The original intent of it was as a vehicle to transport things through the skin into your system, and it worked very well for that. It still works great for that. Say, for example, you have an inflamed joint, you wanted to get some ketoprofen in there. You didn't want to take it systemically where it could affect your liver, like we talked about, and get it to the source. Then you could use ketoprofen or even steroid, cortisone, or even more potent ones into the actual joint, and that vehicle works good. But unfortunately, what happened once or twice was back many years ago, a migrant worker was working in the fields, probably picking soybeans or something like that, in the fields, because it gets very taxing, they get very sore, they get injured. And so DMSO was around, it was over the counter. So this one worker put it all over his body, all over his joints, and waded out into a field that had all these pesticides in it. And all those nasty, toxic pesticides got into the system and killed him. And that's what gave it a bad name. But with smart use of it, it's just an incredible multi-use thing. Like I say, go to the Midwestern doctors. If you want to get a really good rundown on it, look at his podcast on DMSO. You can just Google it. It'll come right up, and it'll take you some time to sort through it, but try that. It'll be worth it.
Thank you, Deborah, for that. I hope that helps. Real quick for Go Vols, discuss the NAD delivery forms, pill versus liposomal. How are you looking at NAD delivery forms?
NAD's it's hard to get in orally. So liposomal always is a better choice, but they're even giving NAD through IV, through subcutaneous shots. So those are always better. Orally, hit or miss, usually miss, in my opinion. I've tried it and didn't make much of a difference. But
one thing I'll point Go Vols to is Robin Riddle did an Explain This episode on our YouTube channel. Goes into NAD Plus in detail. Yeah. It's on our YouTube channel, Performance Medicine. If you look for Performance Medicine NAD Plus on YouTube, it'll show up. It's about, if I remember correctly, 15 minutes long. So kind of short, but really detailed. Goes over all the NAD stuff you need to know, because it can get kind of complicated.
A lot of these peptides are complex. Robin's so good with peptides.
Yeah. So check that out, and you'll see a number of different episodes on other peptides with Robin. So thank you. Thank you for that question. All right. Rich is saying put some serapeptase in there. I love that.
Yeah.
I love that. Thank you, Rich.
Yeah.
Guys, how do we do? How do you think we did?
I thought it was fun. I thought we did great.
I thought I'm going to turn off
You were
the podcast.
funny. You were funny, I think.
Guys, let us know in the comments how we did. I'm shutting off the podcast now. We're just live with you guys. We're going to call it a show. You'll see the coupon code down there. Live 15, that's going to be available throughout the rest of the evening. So if you haven't gone to performancemedicine.net, you can still do that after the show. That coupon will be live for the rest of the night. Live 15, it'll get you 15% off everything on our store. So Ivy, thank you so much.
Ivy, it's so great to see you. Thanks for that piece of steak the other night.
Yes.
It really made my day. It really did.
That's amazing.
You're an amazing nurse. I'll tell you that, as well as person.
I got to hang
So
out.
is Tony.
To hang out with Ivy and Tony at Ben's wedding, which was phenomenal
That was a lot of
this
fun.
past weekend. So great to see you this weekend. Thank you, Rule. Thank you, Rich. Thank you guys over there on Instagram. We're going to call it an evening. Live 15, head over to performancemedicine.net to check it out. Sandy, thank you so much. Mark, thank you so much. We got to get the dogs in here. I don't know where they're.
They're down. They're out
probably
playing.
outside.
They're like every other dog. They're playing in the summer.
All right, guys, we're going to call it a show. We'll see you next week. We'll be back 7 to 8 Tuesday next week. And where's my outro? Where's Brad at? Where's Brad? Come on, Brad.
Don't go away.